Why is plastic surgery informed consent so confusing? Imagine deciding to change your appearance and feeling confident about your choice. But then, the process of giving informed consent can seem complicated and overwhelming. That's because it involves much more than just signing a paper. It is a detailed process designed to make sure you truly understand what you are agreeing to. First, the information involved is often very detailed. Surgeons need to explain the surgical techniques, what could go wrong, and what results you might expect. They also have to talk about alternative options and realistic outcomes. Since medical language and risks can be hard to understand, doctors try to simplify explanations without losing important details. Still, this balancing act can sometimes make it confusing for patients. Second, plastic surgery is usually elective, meaning you choose to have it done for aesthetic reasons. Unlike urgent surgeries needed for health, these procedures are about personal choice. This puts extra responsibility on surgeons to ensure that patients are making decisions freely and without unrealistic hopes. Media and advertising can influence patients to expect perfect results, which makes it harder for surgeons to set honest expectations. Third, respecting your autonomy means giving you the right to decide about your own body. But figuring out if you truly understand the information and are capable of making a decision is complex. Doctors are required to provide accurate details, but they aren't always able to confirm that every patient fully understands everything. This can create gaps between what is explained and what the patient actually comprehends. Fourth, there are legal and ethical rules that surgeons must follow. If they do not provide enough information, they risk legal trouble. That's why consent forms often include detailed lists of risks like pain, bleeding, dissatisfaction, and rare complications. While this documentation is important, it can also make the process seem more bureaucratic and confusing for patients. Fifth, there is no single standard for how consent should be obtained. Some surgeons spend a lot of time discussing risks and use detailed forms, while others may provide less information. This inconsistency can make it unclear what proper informed consent really looks like. Finally, the timing and setting matter. If consent is rushed or done after sedation, patients might not fully understand what they are agreeing to. Ideally, consent should be an ongoing conversation that starts well before surgery, giving patients time to think and ask questions. When rushed, patients can feel pressured or unsure about their decision. In summary, plastic surgery-informed consent can be confusing because it involves explaining complex, detailed information about elective procedures. It requires balancing patient understanding, autonomy, and legal standards. Surgeons need to communicate clearly, provide thorough information, and document everything carefully. This helps ensure that consent is truly informed and that patients are making decisions they feel confident about. Always remember, for any procedure, it's best to discuss your questions with a qualified healthcare professional who can give personalized advice based on your unique situation.